We're going to get started. So once again, everyone, good evening and welcome to the Black Health, Black Liberation panel series. My name is Melissa Watkins. I am a member of the Democratic Socialists of America, Afrosocialists LA Caucus, and I'm honored to be tonight's panel moderator. Just to give a background on this panel series, it was created in response to the uprising taking place across the country. They're bringing attention to the injustices of the police brutality and systemic racism. But how do movements like Medicare for All meet this moment, especially in the time of COVID-19? Well, this series seeks to convene activists and organizers who are fighting at the intersection of healthcare and Black liberation. So tonight's panel, Care Not Cops, will focus on the movement to defund the police, the need to reinvest in Black health, the health consequences of the prison industrial complex, and the need for transformative and healing justice. So just to give you an overview for tonight's presentation, our panelists will share their thoughts on proposed questions and answers. Or proposed questions, they'll give their answers. And then we'll allow time at the end of the discussion for questions from our participants. While our guests will be muted during the conversation, we ask that you use the Q&A feature to raise any questions. This session will be recorded and shared after the event. So before we get started with the Q&A, we want to acknowledge some of the organizers and supporting agencies that helped make tonight's event possible. We'll start with the DSA Afrosocialists and Social Justice of Color Caucus. We advocate for and build power with DSA's members who are Black, Indigenous, and people of color, and their communities. Through public and internal education and agitation, we aim to continue the legacy of the Black radical tradition, as well as the radical traditions of other oppressed minorities. Dsa Medicare for All Committee. They organize pressure campaigns, communications, and policy work through a network of over 30 regional organizers to engage DSA chapters and activists in the fight to win improved Medicare for all. People's Action. They are a network of community organizations taking on corporate power in healthcare to win a healthcare system that is just, so that everyone in the US has a chance to survive and thrive. Physicians for National Health Program is a single issue organization advocating a universal, comprehensive, single payer national health program. Healthcare for All LA. Their mission is to educate, activate, and encourage people to participate in advocating for just, equitable, accessible, comprehensive, affordable, and quality healthcare in a publicly financed, universal, single-payer system. The Center for Popular Democracy is a network of 55 of the most powerful grassroots power-building organizations in the country, organizing in 32 states, DC and Puerto Rico. Their affiliates are multi-issue, multi-generational, and multiracial, with over 70% of their organizations led by people of color. They are committed to winning Medicare for all, and they mean all. Healthy California Now. They're a statewide coalition of organizations and activists dedicated to establishing a single-payer Medicare for all system in California. Their goal is to eliminate all barriers to care. And last but certainly not least, the National Union for Healthcare Workers. They represent over 15,000 health professionals, including nursing home workers, mental health professionals, nurses and technicians in hospitals and clinics. The union is dedicated to winning single-payer healthcare and sponsors the Healthy California Now campaign. So thank you again to all of the organizations that helped us be here today. And we're going to turn over to the panel discussion and introduce our panelists. We did have a shift in our panelists today, and we have Jeanna Harris. She's a registered nurse and a member of Healthcare for All LA. She's been a registered nurse for almost a decade and a tireless patient advocate. She currently works in case management, where she coordinates care for patients and helps them navigate the insurance world. She dedicates her free time to political activism and is a passionate Healthcare for All advocate. And we also have with us Greg Akili of Black Lives Matter Los Angeles, and he's the director of the Fannie Lou Hamer Institute. Baba Akili has 50 years of experience as a labor community organizer and political leader. He has worked with numerous organizations, including the NAACP, Obama for America, SEIU, and United Farm Workers. He serves on the Black Lives Matter Los Angeles committee as a core team member and has been an active advocate for defunding the Los Angeles Police Department. So thank you both for being here today. Dr. Robert Fullilove wasn't able to join us, but we're going to proceed with Jeanna and Akili. So thank you.
Thank you for having me. I'm thrilled. And I was just looking through some of the chat and I saw someone checking in all the way from Alaska. So what up, Alaska? That's really dope. Thank you for, checking in on this. I think that's just really awesome.
And I appreciate being here. This is an issue I've been working on since the late 80s, and doing what I can to help advance it. So this is an issue that's near and dear to my heart.
Well, thank you both. And we'll get started with the questions. I have several prepared questions. And again, we invite our participants to put any questions that they have in the Q&A feature. They can put them in the chat, although we may not see them. So if you could use that, I'll probably say it again 3 more times. Okay, so the first question is, what would a single payer system do for racial justice? And please, both of you, feel free to interject on that question as you like.
I'll let you take it, Baba Akili.
Do me a favor, repeat it again.
Okay, what would a single payer system do for racial justice?
Okay, well, let me start out by doing a couple of things. One, reminding people of the state we're in. A James Baldwin quote comes to mind: to be a Negro in this country and to be relatively conscious is to be in a state of rage almost all the time. So there is this rage. And there are 4 conditions that Black people have to face in the US: white supremacy, institutional racism, individual bigotry, and mass denial. And so those 4 conditions have led us in many ways to where we are now. And we're at a critical point. The combination of outrage, anger, and disgust at the murder of George Floyd, Breonna Taylor, Ahmaud Arbery, and just recently right here in LA, Dijon Kizzee, is causing many people in the US to really begin to see institutional racism, something that Black people have seen all our lives here, but others are beginning to see it. It's a heavy price to pay for Black people to pay so that the rest of the world, rest of the US can see what's happening. And it certainly applies to healthcare. And Medicare for All, or a single payer system, is a beginning way to deal with the fact that in most cases, Black people, because of the 4 conditions that I talked to you about, particularly institutional racism, have either been eliminated from actual access to health. Even when they get it, they have been discriminated against in terms of their illness, or misunderstood and I'm not going to say misdiagnosed, but maybe underdiagnosed because of how cultural racism and institutional racism fits in. So if a single payer Medicare for All system is to work, it has to have, first, Black voices. We have to be a part, and not just, as Malcolm says, just because you are at the table and you don't have a plate doesn't make you a diner, it just makes you sitting at the table. So we got to have Black voices, Black views that's connected to those voices, and a Black vision. What is it we see? So those are some of the things I think are critical to making Medicare for All work. I think, first of all, the cultural acceptance to Medicare for All has to be struggled with. Unfortunately, in America, if you say all, first of all, Black people think it don't mean us, because there's enough history of this country saying all da 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 da, and we knew it didn't mean us. The other thing about all on the other side is that there are many whites who are not willing to accept a system where all of us are actually in it. And the worst examples are the 1935-36 Social Security. Many whites opposed Social Security because they didn't want Black people to have that benefit. And just recently, with the HCA, many states in the South and throughout the country refused to accept the ACA because they knew it would provide health care for Black people. And so they rejected it, even though it would provide health care for their own people. Now, some of them have come around, but as long as there's the belief that Black people, Latinos, other people are going to get something that supposedly is for white people, there will always be that struggle. So on one hand, you have the reservation and questioning from Black folks about, do they really mean all? And then secondly, on the other hand, you have resistance and cultural racism from white folks who are like, all white people, but not them. And how Medicare for All can at least begin to address, first access, because of, and then secondly, the question of discrimination. Once we get the access and we are all in, Black folks are in and are fully represented, the next struggle is going to be around the question of healthcare discrimination and disparities. But that's a internal struggle that we are going to have to fight, make demands, and ultimately deal with. But we got to get in first in this case. We have to have a Medicare for all. And the question I always ask myself, and I ask others who resist Medicare for all, is if Medicare for all works well for people 65 and over, help me understand why it wouldn't work for people who are 45 and over, or 35 and over, or 25 and over. And part of it, I think, is helping people see that this is a system that works. This is a system that is much more cost effective. This is a system that doesn't put insurance companies between you and your healthcare provider. So the struggle is to make Medicare for all really inclusive. Secondly, to deal with the internal conditions around healthcare disparities and discrimination. And then finally, I think getting all of us to accept it as a simple, applicable, and comprehensive way to make healthcare available for all of us. A long response to a short question, but thank you.
I always, I've been on quite a few panels with Baba Akili, and I love the way he delivers it. That's why I let him go first. And because he knows the history and everything. I mean, I've got some skin in the healthcare game on the inside as a nurse, and now getting even deeper into this dark world of healthcare, being into the administrative side. But when Baba Akili just delivers it, I'm just like looking like a kid looking at this, just like, oh my God, but from my standpoint, being inside the healthcare system, one of the things, and Baba Akili is absolutely right. When the Constitution was written, and it was like, all men are created equal. Well, we already knew women weren't included in that. And then we knew that they meant a certain shade of men. So back to all. We know all has an asterisk by it, So, when we are trying to really get this going, I know Baba Akili and I have already discussed, we're going to have to really kind of be the face out here, dispelling the myths. My biggest concern about pushing single payer healthcare is when the insurance companies come out. I know my particular field, millions and millions of dollars already set aside for lobbyists to just have fun with when it comes to getting rid of this. And so when it comes to single payer coming out, we're going to have to be in the community, boots on the ground, literally talking to people, because just like the tobacco industry, that's a perfect example. The tobacco industry came right into the Black neighborhoods, pumped us up with our celebrity endorsers, and it looks so cool, and they had all the targeted advertising. They're going to do that the same way for private insurance, knowing good and well none of us have those types of plans. And so when it comes back to, how it will help us, health is wealth, pretty much. I feel that down to our very DNA, we have been struggling for survival for over 400 years. And for once in life, can I be out of survival mode and thrive? And one part of thriving is healthcare. I need to know that if I hit my foot, and this happens, I see this all the time, your grandma, your auntie, uncle, maybe they're a little older, they got the sugar. If they're from the South, they got the sugar. And they haven't been checking it normally. They're rationally their insulin, and they hit their foot, and they have neuropathy. And that little itty bitty bruise becomes a big sore, and that becomes infected. And they still try to treat it at home because they can't get to the doctor. Or maybe they might even have a doctor, but that doctor can't see them because that one little community office there is so overwhelmed. He's booked out for 3 months. Make a long story short, Granny just lost her leg because it just was not treated properly, and the access to care was small. And so helping us out, and grandma might have been fully functional. She might have been, still cooking big Thanksgiving dinners. She might have been, still driving, going to the grocery store, doing her thing on her own, independent. But now she lost her leg, and that just took years off her life. And that is right there where I'm looking at why we need this. Because our lifespan, not just being killed by the police, that's a whole nother thing. That's like the CDC literally is going to have to make a new demographic for death rate and put that in there. But not just that, but actually, our health and just these small things that, a lot of people take for granted actually could really change the entire dynamic in our community. If we're healthy, we could be wealthy. And, because we're not focusing on just taking care of our health. That means if we're not focusing on just those small survival things, we can focus on our businesses. We can focus on growing our communities. But right now, we have been put in such a tight box where, we're being kept sick. We're living in areas that are under environmental assault. Where our respiratory systems are being attacked. We're not being educated properly on how to take care of ourselves in a healthy manner. Why is it that there's no Whole Foods in the hood? And if there's a Whole Foods in your hood right now, guess what? You're about to be gentrified. I'm sorry, homie. Why is that? And going back to, like I said, you keep us sick, you keep us controlled, you keep us focusing on the things that we don't need to be focusing on. It's a whole systemic sickness. And I'm trying to promote wellness, but at the same time, to conversely on that, we also have to be open to that. Historically, we have not had a good run in the healthcare system. We don't have any reason to trust the healthcare system if you look at the past. But at the same time, we have to start being more open to growing and learning, but means we need healthcare providers that look like us, that know us. And one of the things with Medicare for All, and I just said this earlier, is that Medicare for All isn't just about granting access. We have to literally change the way that me as a professional and anyone coming through school is taught. Since healthcare racism is taught. And it might be taught subliminally, but it is. So that's another thing that Medicare for All has to address. It is not just giving access. It is a complete ripping apart and rebuilding of the American healthcare system. Long answer again, I'm sorry.
Oh, I love it. Thank you. Thank you, Akili and Jeanna. That's a perfect start to our conversation, especially as we switch over to the policing aspect of healthcare. And so I would like to start with this question. How would you characterize the current prison system?
It's a zoo. How about that? I have a brother who's incarcerated, by the way. So, and I've had I was kind of the kid that actually stayed somewhat on the right path, but a lot of family members in and out, my little sister in and out the juvenile system. So I'm very familiar with this system. And while I may not have experienced it personally, like I said, my family has been through it. And one thing I have come to say, and I said this kind of like in a one of those Kevin Hart laugh at my pain scenarios, not making a joke of it, but like literally this is how crazy this is that if the private prison industry they don't have any type of insight, or they don't want to reform and rehabilitate people to have them come back into normal society. They don't want that. They're getting your cheap ass labor and they're making money off of keeping you there. Because we know, I'm pretty sure everyone on this panel and on this webinar right now knows that it is more expensive to keep someone in prison than it is to bring them out and rehabilitate them back into society. Now, I'm just putting that out there. So I said, you know what? I was like, this isn't a prison. This isn't a rehabilitation center. This is a flipping zoo. Sorry, almost dropped that F-bomb. This is a flipping zoo. I said, you take people and you put them in cages, and then you don't do much to rehabilitate them. You don't give them the tools that they need to learn from whatever the charge was, or if it even was a charge. Let's talk about that. So the prison system is a joke. And you know, I go back to when I saw Where to Invade Next by Michael Moore, and they talked about the prisons over in Norway and all that stuff. And I mean, murderers literally like getting classes and rehabilitating with and kept in humane environments. Humane, like, you know, they look like dorm rooms. Now, granted, I don't think that taxpayer money should be putting people up and, you know, living like a Beverly Hills life, but living in a cell on a metal slab with a cushion that's this big, that is an animal. We are not rehabilitating people to acclimate back to society. We are basically creating an animal that will come out and just, you know, not have any, especially if they're doing a long sentence, they're not gonna, you know, how do they acclimate back to society? And why is that? And I don't think it's just because, oh, well, we didn't know, the evidence wasn't there. I'm a nurse, I'm big on evidence-based practice. And I'm like, you know what these people need to rehabilitate and to reacclimate back to society at the end of their sentence, but you don't give it to them because you want them back in there. And that is the problem.
And I can speak to you from personal experience, both having spent time in the feds, in the state and federal prisons. One of the things I learned about the state prisons is that they make no pretense about it. They are not about rehabilitation. They're about just locking you up and warehousing you. The feds used to make because my last time I was in federal prison, and they used to have some rehabilitative kind of stuff. Matter of fact, I even got accepted, if I remember correctly, to UC Irvine from the penitentiary. Now, I didn't get the parole I needed to accept it, but the fact that they were willing that I could do that in the federal prison I was in. But it's connected to a culture of punishment and racism. So our society is built on, first of all, on racism, and then because of that, punishment. Our first response to solving almost any problem, particularly if Black folks are involved in it, is punishment first. And if that doesn't work, we'll try punishment more. And if that doesn't work, we'll continue to focus on punishment. If you see what's happening now with the fact that the US has more people in prison than any other country in the world, it's focused on that. And the idea of saying, well, wait a minute, that doesn't seem to be working. How about let's try this? We never get to that discussion because we are so focused on punishment, which is connected to racism. And I remember being in federal prison, and the funding got cut for the programs that we were trying to do. And so they just wound up locking us up there were some times when you know, we had programs. We actually had at one time in the federal prison I was in college programs that we could enroll in right in the penitentiary. There was a cut at the federal level, and they cut them out. And so they were now. Many people, we used to call it programming, were doing that because they wanted to get paroled. And if they saw when you went for the parole board that you were doing these things, that helped. And it did. But we cut all that stuff out and just simply warehouse people now. We simply lock them up and warehouse them. And one of the things I remember when I got out, you are resentful as hell. Everybody I saw in a uniform was always connected to the prison guard that I had seen on a daily basis. And I resented the hell out of them. And it seemed like everybody I had to prove and reprove myself that I wasn't, in fact, that I was, first of all, deserving to be out, and secondly, to stay out. And it was a constant proving and reproving. Now, I'm lucky in the sense that when I went in and got out, there was a lot of activism going on. There was the Black Power movement. And when I came out, I got involved even when I was inside. But because of that environment, it helped turn me from a petty hoodlum into a social and political activist. But there's absolutely almost nothing now. If you get out, you on your own. And you can't hang with certain kind of people now. You can't have certain kind of things now because you can get violated like that. So the whole penal system is focused on punishment first, and making it almost impossible for you to turn your life around. I mean, the first thing that I remember I did when I got out was I tried to register to vote, because we had talked about it and I had to wait until I got off parole to do that. I couldn't just register. I had to get off parole to do that. And many of your rights aren't restored to you. That's the other thing. In many states around the country, your rights. In Florida, you have to prove your moral turpitude. And even though they passed a statewide initiative that would allow formerly incarcerated to register, now you have to pay off fines and penalties. In many cases, you can't even find what they are. So there's a orchestrated method for, even though you've ended your time, you are still being punished in this society. You are still an ex-con. I'm glad that I worked on banning the box because I learned early on when I got out the penitentiary, if I checked that box, they never called me back. But if I didn't check the box, at least I got called back. I may not have got the job, but they at least called me back. So I just stopped checking it altogether, because if you check that box, if you've been convicted of a felon, that's it. They ain't gonna, And so simple things like that. But part of it is that we have to see and be willing to understand that the warehousing of people does much more damage to the front end and the back end. Because ultimately, if you ever let them out, and like I said, I remember this, you are terribly resentful because that time that's been taken from you, you ain't never getting back. And a lot of stuff has happened in your life. You have to work to overcome that. And we don't help people work through that to become ultimately productive residents and be able to take care of themselves and their families.
And just to add, like when it comes really quick, I even add, I'm going to flip it, like sometimes, know thy enemy. And so I even argue from the capitalist standpoint, don't you want as many Americans as possible productive in the American workforce? You want us at all levels. You should want us working, right? Because that pushes your GDP, that pushes all that stuff. Why is it that, just you're holding certain ones back? But at the same time, it goes back to the racism, like looking at me because of the beautiful brown color of my skin, and I'm adding that beautiful, putting a big B on the beautiful. You literally look at me as subhuman. I don't deserve to make the wages that you do. I don't deserve to do this because, well, you're colored. And I'm just like, well, everyone has a color in my opinion, but nonetheless, this is a huge problem that really, needs to be addressed, and it is intersectional with healthcare.
And Jeanna, Akili, that's perfect, because now I want to ask you a little bit to dig deep in everything that you just described, because I could feel the pain as you were both speaking. Let's talk about like how the prison system affects mental health.
Well, let me just give you an example. You are confined in small spaces. I remember I could stand up and touch my walls like this. So when I reached out my hand from side to side, and it's a pressurized situation where you have to always be concerned about the guards, and you always, and in some cases, certainly now, you have to be very much concerned about other prisoners who may and certainly there are a lot of races. And I remember that was one of the first things I had to do when particularly in the state when I got locked up, was connect with the brothers, because there was always this racist group of Nazis and whatever in the penitentiaries. They were all, and they grew, and the guards knew about them and the rest, and they never tried to do anything about them. And so there's this constant pressure on you, and you're in a pressurized situation. And then when you come out, you have to adjust in ways that that most of us don't have to adjust to. And so if you went in with any issues or problems or considerations, the penitentiary is the absolute worst place to be, because one, you won't get the attention you need, two, because of the constant pressure you feel, and three, because of the internal, and in some cases external danger you see around you. And so coming out, well, even being in, if you enter with problems, they only are aggravated. They only are worsened. They only are exacerbated, while you're inside, because of that environment. And even if somebody recognized something was wrong, even if somebody said, there's no provisions, interest, or understanding in trying to help you with it. And so even presumably in the past 20 years, we spent a lot of money on mental facilities, but even there, I mean, it is basically a penitentiary with maybe some clinical people around, but it's a penitentiary nonetheless. And the other thing is that we simply do not provide mental health internally and externally. Well, that is once you leave. And that is the critical time. Helping you make that adjustment back into society, it's not an easy thing. And this has been many years for me, but talking about it is like, oh, damn, I remember when I got out, it was hard. And I mean, so it has been many years, but refreshing my memory now. And part of, I think, the provisions that we are going to have to make pre and post. Before you get sentenced, there ought to be mental health support, counseling, and a number of other things. And then certainly once you get out. And in some cases, quite frankly, I mean, one of the reasons why there have been, for the past 2.5 years, a big push to not build more jails is because right now in LA houses the biggest facility for the mentally ill is our jails. And so if you build more jails, if you build it, they'll fill them. And so many of us, and certainly what happened with the reform LA jails, was not to build more jails or cages. You cannot get well in a cage. And that was an underlying context and an underlying position. And so I'm working with and supporting and participating with, to the degree I can, others who are working on that to make sure that we have, first, the pre, secondly, if you have to be in during, and then the post. Because you cannot get well in jail.
Absolutely not. That's why it's care, not cages.
Yeah.
And, I definitely mental health. I agree. I think that there should be a mental health evaluation, because why are a lot of people, and like I said, I go back to the evidence. I like science. I'm a little bit of a nerd. And so the evidence of why are people committing these crimes? A lot of these petty crimes and nonviolent crimes are done out of survival. And then a lot of people are getting locked up because the police get called for a mental emotional and they don't know what to do with it. Why? Because they're not psychiatrists, they're not social workers. They are supposed to be the, protectors, the protect and serve those who don't look like me. But, that is what they're there to do. They're not there to handle a mental emotional. So if that mental emotional person, and I use this example with a friend of mine who is against defund the police. She's more of defend, and she has children with autism. And I kind of brought the Elijah McClain story. If you have a child, or maybe a young adult, let's say young 20-something, who has not been treated properly for their autism, and they have an autism meltdown in public and nobody knows they have autism, someone's going to call the police. The police are going to come, and they're not going to know that this person has autism. They might not even be able to identify it. Likely, they're going to think it's a drug problem. And they're going to engage this person. And I mean, it's getting worse. That person may end up dead, or that person's going to end up in jail, one or the other. And when that person ends up in jail, you know, now you take a person who has a mental illness or a mental disorder and put them in jail. Now, here's what it really does, because I've worked trauma. And so, you know, they might swing the person around to the ER to be evaluated and cleared. And in trauma, we make sure that you're alive. You know, we're not looking at your psychological, we're looking at your physical. Are you going to keep breathing? Are you bleeding? Are you doing, okay, none of that, good to go. We might give you some medication to calm your happy ass down, bye. And you go to prison to be processed, or to the jail to be processed. And so where did we identify that this patient or this person had a mental issue? Where did we look at this person and say, you know what? It looks like this person this might be autism. This might not have been a crime. Now we're charging this person, you know, with maybe they hit the police officer or something. And now we're charging this person. And so now, you know, we've completely went way off left field with this person who was just having an autism meltdown, you know, and now they're in prison, sitting in some processing cell, probably having a bigger meltdown, you know, and now here come the guards. And now, you know, here comes violence because this person's having a bigger meltdown. So now they may get more injured and more assaulted because the guards don't know. And so that is the truth, the way things really can go down. And like I said, at no point have we looked at the true mental health. And that is one issue. The other issue is, for example, my little sister. My little sister has mental health issues. She has since she was young, in and out, juvenile, and now in prison. She had her youngest child in prison. At what point did the prison system help her? Not at all. Not at all. You know, it's hard enough trying to get her to take medication and go to her, you know, psychiatrist appointments and things like that on the outside. But was she getting it on the inside? No, not at all. So now she comes back out. She can't be a mother. You know, she's not, you know, fully there. She hasn't gotten that into her mind yet. So it's a constant fight. And that didn't get any better in prison. And did they even offer her services? No. And that's like I said, what we're missing here is the root cause. We're institutionalizing people who actually just need help. Like truly, they need help. And like Baba Akili said, even mental institutions, and I've done my, you know, my rotations on psych units too, even those are very much so cold and calloused, and they are not for the mental healing that you need to recover and repatriate and become a person, a contributing member of society. You know, very few people with mental health issues actually feel like they are part of society. They always feel stigmatized. And now I think more than ever, I'm seeing more like normalization of, you know, it's okay to accept your mental health, you know, like it's okay to approach this. Black mental health is a trending topic. But, you know, right now we have generations, you know, that are already damaged. So in prison, are we really doing anything to help them? If they were having a mental disorder before, even if it was maybe depression, you think that depression is going to get any better being put in a cold jail cell? No. And they do have psychiatric services that come into a prison. It's usually some, I'm not trying to downplay it, but usually I would say they're not the best are caring people that come in. And they may prescribe or they may not. And they may say, they're not suicidal, they're fine. And then they walk away. So how are we giving care? How are we helping people get back into society? We're not. Why? Because they don't want you back in society.
Well, thank you both for sharing your personal stories and eloquent answers. Jeanna, you mentioned before that prisons aren't a place for rehabilitation. And of course, Akili, you said the same thing. The next question is, do we need to focus more on rehabilitation? And I think we all agree that we do. So I would like to change that question as to how do we change the system so it focuses more on rehabilitation?
I mean,
well, for me, there's got to be a commitment, understanding, and accepting that, first of all, what we are doing now is not working, and that we have to change it. And those changes have to come from the people who have firsthand experience, not just from theologians or academics or the rest. And I know some of us like science, but lived experience is very valuable. And too often what we do is we just rely on the science and don't include the lived experience. So I would start there, start with that commitment. But that commitment is going to have to come from a set of demands. And those demands are going to have to come from the families and from the general and from the community of people who are seeing their loved ones deteriorate in front of their eyes, or seeing their loved ones not being able to adjust and become, functioning people in the society. So so starting with that demand for resources, because we are a rich country, one of the richest countries in the world, so we can have a just, fair, and equal society. That's the question, is if we choose it. So committing resources to real care, that's the first thing. Then secondly, once those resources are committed, then they have to be monitored and make sure that they are doing the work that they were set out to do. One of the other things, I mentioned the culture of punishment. Even when we give or provide support for people, we do it in such a way that dehumanizes them, and an extension of the punishment. And so we need to get the demands, to allocate the resources, but also to struggle against the stereotyping, victim blaming, and that goes on now. You must be doing something wrong, or it's your fault, or see, what you need to do is we got to get away from that. That many of the conditions that exist are not people making conscious, clear decisions about it. There is something more there than just, and I like your analogy, Jeanna, about the autism. Many of us may not understand what that is. And if we see somebody acting differently, then our assumption is something's wrong with them. Not that they may be having an issue, or not that they may need help, it's something is wrong. And so that's the other thing that we are going to have to deal with, is the cultural understanding and ending the victim blaming and stereotyping that goes on. And then, so the resources, the ending of the victim blaming and resources. And finally, a willingness to, even when mistakes are made, or it doesn't work just right, or it needs constant tweaking, to be willing to commit to that. Because if it worked right all the time, then we wouldn't even need to be talking about it. But there will be glitches, there will be breakdowns. And what I've observed over the years is there's a breakdown or a glitch or something, we say, no, see, I told you that wasn't gonna work. Well, no, you have to constantly make it work. It can't just work on its own. So the resources, the commitment to supporting the humanity of a person, not victim blaming and punishment, and then finally being willing to work and rework until we get it right.
Yeah, I completely agree. I think that rehabilitation for someone coming out, it starts while they're in. Even if, to me, rehabilitation starts from the minute you walk in. You've been sentenced, you did your crime, now you're here to do the time, it's time to start rehabbing you. That's when it should start, truthfully. And then also the resources need to be out in the community, so maybe you would have never ended up there. But, if we're talking about, going through, to me, we need to be allocating those funds back in. And I understand, a lot of our politicians and, the people in power, don't agree with the fact that we need more programs. We need to invest into people, even if they have done some type of crime, if we're planning to rehabilitate them. And we also need to invest in the community to prevent these crimes from happening. People like to use Chicago as an example of Black on Black crime. Well, look at Chicago. What about Black on Black crime? You guys are screaming defund the police, but look at Chicago. Look at Chicago. And I'm like, hey, someone who spent many, many years and summers in the South Side of Chicago, let me tell you, this is not the fact of people, me looking at Baba Akili and saying, I don't like you and pulling a gun on him. This is decades of oppression, being completely shut out, and then being over policed and not having the programs we need. I remember there was a summer camp, and I went to the summer camp many years in a row, and then you just saw the decline of that camp. You know, we used to be able to take field trips and all that stuff. And then by the last time I was at that camp, and it was like a community parks day camp. And by the time the maybe third year or so, those field trips stopped. We didn't have really any lunches. We had to start bringing lunches. Now, these are kids in the South Side of Chicago, you know, like their parents were struggling enough. Now they got to bring their lunch. And so you just saw, and I was too young to understand it. But going back, now you saw how that money was just plucked out. How it was just plucked out. And now you want to know why people are, you know, oppressed. You did it, you know? And so, I mean, the reinvestment's there, but like Baba Akili said, we have to demand it more than ever. And I think and we have to make it heard. And most importantly, we have to make sure that the people who come to us for votes, who are saying, yeah, I believe in this and I support Reimagine LA and yeah, care not cops, or, you know, and care not cages. We have to make sure if we get them in office that they do it. You know, they come to us and come to our communities with a lot of promises, and then they don't even try to uphold that. So we have to hold them accountable with our demands too. Like, you know, you agree to them, now put it to work. And we also need to put deadlines on it. You know, like, I want this done, and, you know, I want it done now. If you want my vote, I want this to be a priority. I want this in my community within the first year of your term. That's where we need to go. We need to be stronger on the demands. And I think I'm learning that from Baba Akili, where I'm just like, you know what? I'm done being nice. I demand this right now. And, you know, and I'm in the Democratic Party. So I'm just like, and now it's like, no, I'm demanding this because we deserve it, because I know it's going to help us. But, you know, like I said, we've just straight up been bamboozled, you know, like that's the truth of it. And now it's time. I think the only ones that are going to fight for us are us.
And that has always been the case. And as Frederick Douglass says, power concedes nothing without a demand, never has and never will. That's why I always want to translate our positions into demands. I also we do have intra-community violence, but all communities do. And white people kill each other at the same rate of Black people, but nobody talks about white on white crime. It's only when it's convenient to do it, to talk about Black on Black crime, as if, and it is one of the first ways that you can criminalize a race if you talk that. And then part of the pushback that many of us have exerted, that yes, there is intra-community violence, but all communities experience that. You know, but we rarely racialize it. That is, we rarely make it about the race. We always make it about conditions. And one of the things we talk about with the people's budget, which is something that Black Lives Matter is we're the driving force behind it, is that we've learned that how to make communities safe is not by doing more policing, but by resources. That's why we talk about divest, invest. The police, so I'm going to stop here because I was just about to go into the people's budget and what we're doing. So, but let me see if there's another question, and that question may get to what we're doing around the people's budget and defunding the police.
Well, it actually does. The next and final question is kind of a mixed one. It's how do we uproot systemic racism? And you've both been speaking to that. And then also is going to add on to that, how is your work with your respective organizations, or what was your approach to affecting change? So it's kind of like a loaded double question, and you've both been speaking to it. But again, how do we uproot systemic racism? And then what's your respective approach to affecting change through the organizations you're working with?
Well, for Black Lives Matters, our focus is on ending state-sanctioned violence in all its forms, social, political, and economic. We have been focusing certainly on police violence because that is in part how we got started. We moved from a series of hashtags in 2013 to 2014 when we met in Ferguson and became really an organization then after the Mike Brown shooting, and then went back to our respective communities to talk about ending state-sanctioned violence and how we were going to do it. And that's why most of us, and certainly here in LA, we have focused on that by doing two things. One, demanding justice for the families of people who have been killed and holding police accountable. Our next step is to not only hold them accountable, but to defund them. Right now in LA, and probably in most cities, LA, 53% of the general fund goes to the police. They're doing more than they were ever trained to do. They're doing more than they even should do. And they're doing more than they really can do. And as a consequence, they kill us, in part because they are trained to do two things: control and suppress. Control the situation, suppress the threat. And we are always seen as a threat. And so part of what BLM is particularly focused on is ending state-sanctioned violence, justice for the family, accountability for the police. And then the question of how do we get rid of and uproot racism? If I had to answer to that, other than the struggle, other than to push back against consistent stereotyping, and that's that individual bigotry I talked about earlier. Push back and open up and eliminate institutional racism, and then connecting that to white supremacy. This notion that white people have that everything that's in the world they either invented or should have invented, and what everybody else does is not as important or not as relevant or not as meaningful. And then the denial, the fact that in America you can deny, just like this current 45, he says there's no institutional racism in the police force, even though day after day, week after week, year after year, Black people are being killed. And they always want to place that on bad appleism. There's a few bad apples. No, the institution is bad. And because the institution is bad and there's no accountability there, then it's all right to kill us. And that's part of the reason why we have been protesting Jackie Lacey for the past 3 years, because she is unwilling to even try to hold police accountable. And if there's no accountability, the message is it's okay to kill us. So what our institution, certainly what BLM is focused on are those things. And then the question of institutional racism, individual bigotry are going to have to be attacked. I don't know how else to do it. We must, when we see it, we got to attack it. When we encounter it, we got to confront it. We have to challenge, confront, and if necessary, disrupt in order to make the kind of change. As a matter of fact, if you look at any change that's been made in this country in the last 100 years, whether it was women ultimately getting the right to vote in 1920, whether it was the 8-hour workday, or whether it was civil rights or lesbian, gay, transgender, and queer rights, it came out of a set of protests connected to a set of demands that ultimately led to a challenge, confrontation, disruption. And there's no easy way to do that, because there's no rationale, even though men did put forward a rationale, but there's no rationale that you can come up with why women shouldn't have the right to vote. I mean, unless, that didn't happen out of enlightenment. And so it's the same kind of what we are doing now, the challenge, confrontation, disruption, until we can get to that point where whites are willing to accept that our humanity, first of all, because that's what killed George Floyd. That officer was unwilling to accept his humanity. And that's why he kept his knee on his neck for 8 minutes and 43 seconds, because he wasn't willing to accept that this was a human being I got my knee on. And so until that happens, we are going to have to be in struggle.
Absolutely. I say systemic racism is woven into the American flag. When Betsy Ross was sitting there waving that flag that first time around, that racism was getting sewn in that too. So to get rid of it, we have to rip apart the American flag. Sorry, guys, we do. And we have to re-sew it back with equality and equity for all. And that is not going to be easy. Tearing apart cotton just ain't easy. So this is not going to be easy at all. And there's so many caveats, there's so many attacks going on at once right now. And, talking about mental health, I feel like maybe we're probably all walking a very fine line of sanity. The joke was, I didn't ask to deal with the Civil War, the civil rights, the Spanish influenza all at once. But that's what we're dealing with. And when it comes to addressing systemic racism, I mean, it is so it's everywhere. It is like it's like the metastatic cancer of America. And we're literally on hospice. We're kind of on our death rattle. And I've been actually struggling with this. I've been asking questions amongst friends and people, is it even worth it? Why not just get the hell out of here? I know Ghana's been reaching out, telling us to come back home, but then you look back and you're like, no, I deserve a right to live. I am not a subhuman. Like Baba Akili said, that, Derek Chauvin kept his knee on George Floyd's neck exactly for that reason, because he did not look at him as another human being. And that's the problem with us at all. We have a problem with compassion and empathy. That's it. I mean, that really boils down to it. And when it comes to addressing this, and Black Lives Matter and Baba Akili, they're out in the streets and they have pushed this narrative. I mean, even at times when I was like, well, are they being too aggressive? And well, maybe. No. You know what? I looked at it all and I just said, no, this is the time. This is, we're just, in the words of Fannie Lou, just sick and tired of being sick and tired. And so what I'm doing, I'm in the California Democratic Party. I'm a Los Angeles County Democratic Party member. And what I'm doing is I'm working on trying to find the little, the loose thread so I can start pulling from the inside. Because Baba Akili and thousands of people around the country are pulling from the outside. And that's what I'm doing. And then on top of that, I'm trying to get people to the polls. I know that feels like there's not a lot to vote for. I really do. But getting people to the polls, voting in a way that the system is not ready for you to vote is really powerful. That's how we've gotten candidates like Cori Bush, she won her primary. That shook up the system, but that's because thousands of people showed up for her. But then consequently, Trayvon Martin's mom lost her election in Miami by 331 votes. That's it. She had been working. I've been kind of following that race. She had been putting in work and taking her tragedy that really kind of was a catalyst to where we are right now as a movement. And she lost by 331 damn votes. So that's what I'm doing. I'm trying to get people out here to get to the polls. We honestly, to me, this movement has no, if you want to be out there, be out there. If you want to be in, be in. And because, like I said, systemic racism has to be torn apart with and resewn. And that means we need your energy on all fronts. If you can't be out in the streets, throw a little money. $5 can go a lot of way when you times it by 100, 200 people. Or if you want to be just educational, be educational, but educate the right way. No vote shaming, no issue shaming. Don't go to war with the white supremacists online. We go to war at the ballot box. We're going to go to war when it comes to ripping apart these, these legislations. And yeah, I know that, just right now, what was the legislation, Baba Akili, that didn't pass California?
SB 31.
Yes. Why the hell in a Democratic super flipping majority, I'm trying my best not to say that phone, did this not pass? We're just trying to hold the flipping, like, accountable. And we in a Democratic supermajority cannot pass this. What the hell? That means, huh?
We just chose not to.
Well, yeah. But see, that was a choice. And that's a choice they're going to have to be held accountable for. So that's the thing. We can't just sit there and say, oh, we got somebody I like in office and I'm going to walk away. No, no, no. We got to hold accountable. And that's where we're holding them accountable to these demands. We're going to hold them accountable to what they say. We're going to hold them accountable to ripping apart this system because we're tired of it. And there is a light at the end of this tunnel, but it is going to take a while to get there. And like I said, systemic racism is woven into America. It's not going to be a kind of a quick fix. So this is going to be a marathon, a long marathon. Let's call it Iron Man. This is Iron Man. And it's going to be different levels. We're going to run over a volcano. We're going to bike through the mountains. We're going to swim across an ocean, but we're going to keep going because we know we're going to make it to the end. And at the end, maybe I won't be afraid. Maybe, I won't feel like I'm being judged when I walk into a place, but that's the end. But I know one thing as a millennial, and I can speak for Gen Z, it has to end right here. Like, we can't go one more generation into this. It has to end right here so that I can turn my attention from just survival to maybe fighting for the damn climate, which also, if you really follow BLM's demands, it is so intersectional. It covers all this shit. So if you really just rock with BLM and kind of ride this out with us, you really will cross your intersection. That's what I love so much about BLM and their demands, is that it crosses all of our intersections if you just really look at them. And so, if everyone just rode with that, we would just cross everybody's stop. So, that's another thing. But that's how I feel about systemic racism, is that we have to tear apart the flag and resew it. And I have to give, since we were talking about healthcare, and we might have another question. So I'll hold off on that. Go ahead.
No. That was actually our last formal question.
Oh,
and before
cool.
we open it up, we do have some questions that were raised, but are there any comments that you both would like to share that maybe weren't covered already? I know, Jeanna, you were about to say something.
Well, so I want to talk about, since it's kind of like a Medicare for all thing, I wanted to talk about healthcare, really healthcare racism, and, going back to building the trust of the Black community, which is not going to be easy. And healthcare racism is still going on today. You see that with Black maternal health. And, different aspects, and, with COVID-19 ripped the Band-Aid off of all this and really revealed the disparities between communities. And I fight it every day. I try to explain to people who are so out of touch, social determinants of health, why is it that someone in South LA, why are the COVID rates there higher than Arcadia? And I'm like, well, in Arcadia, they have a big enough house, maybe they can spread out. And in South LA, our houses are small, we're multi-generational, we're living closer, compacted together. And, it's kind of, it can be a breeding ground for a virus. And so, that in itself is so, our leadership in all levels is so out of touch with really what's going on with the people that lets me know we've got to get rid of them. There's no saving these people. Like, these people making laws and decisions, and you see that from the national level, but even at the local level, because I'm not, Trump has 180 something thousand deaths on his hands. That to me is crimes against humanity. But even at the local level, there's deaths on the local elected hands too, because we could have handled this better as well. And I just wanted to kind of address that. In the hospital, we deal with it the best way we can. And yeah, I know, some of it, like when in the beginning, people were saying, well, they were discriminating. They were saying that more people who had high blood pressure and had this and had that, that's the reason why they were getting it. Well, actually, those are, factors that go in. Obesity, for some reason, respiratory, asthma, These are the things that are, the virus is being more aggressive with, but also vitamin D levels, which, as Black people, we're normally deficient in vitamin D. For some reason, a study out of Northwestern showed that people with lower vitamin D levels had higher immune cytokine storm responses. And so that was another thing, like, okay, well, that also targets communities of color. And so, the fact that the science was already there and we just still saw such a poor response, to me, like I said, it's just really crimes against humanity. And that just ripped the Band-Aid off of this movement even more. It was like, it kind of like, if you lived in a bubble, you better not be living in a bubble right now or going forward, because there's no reason why you should. Everything, all the cards are on the table now,
And just by way of connecting it to the COVID, I lost my first cousin in mid-August. Mid-August, and I blame 45 for that because how he has approached this, how he and the governor of Florida, which is a kind of mini him, they approached it. It cost people lives, and if you couple a pandemic with health disparities and health discrimination, we are always going to come out, the worse for it. And it's proven over and over and over again. And so part of the reason for needing, I think, a universal healthcare and a single payer system, and I want to move beyond universal healthcare, because I hear the ACA, some people call that universal healthcare, but yet almost 20 million people were not covered. So I don't know if you can call that universal. So I want to move beyond universal healthcare to make that universal healthcare, one, accessible, affordable, and attainable. And that's why Medicare for All is a sound approach at doing that. Now, there's some struggles we are going to have to engage in to make it applicable to all. There's some struggles we're going to have to engage in to make sure that the health discrimination, which, and Jeanna talked about, even starts in our education process, because many doctors aren't taught about sickle cell anemia. So when I have my granddaughter's father has sickle cell anemia, and whenever he went to the hospital, their first inclination, they did not believe, because they couldn't pinpoint his pain, but he was in tremendous pain. And if you don't teach doctors and healthcare professionals about sickle cell anemia, when somebody comes in the pain that results from it, you don't know, you don't understand it, you may not even know how to treat it, and worse, you may not even believe them. And so those are the kind of things that we are going to have to struggle with. One, we got to make sure that there's access and we are covered in that access. Two, we are going to have to make sure that the discrimination and the racism that exists within that access is eliminated. And thirdly, we got to make sure it's applied justly, fairly, and equitably to all of us.
Thank you both. So we have a question here that I'll raise. So, will Medicare for All facilitate community control of healthcare?
It can.
Yeah.
One of the things that in the early days of the single payer system, there was a paper that a friend of mine wrote, a paper about using the community college model for clinics to do the same things for clinics. So there is a way to do that, but I think the thinking has advanced beyond that now to one, as we look at reparations, and that's part of a demand. Part of that reparational demand has to be for access to healthcare in our communities with culturally sensitive healthcare professionals. So as we move and advance the struggle for reparations, that has to be a central theme, and that's one way it can be controlled.
Absolutely. I think that, you're more likely to listen to a provider that looks like you. And I know this from personal experience, both as a patient and as a nurse, that, I would have plenty of nurses or doctors that I would work with and they would be discriminatory because we would be working in, you know, East LA or, you know, or kind of community hospitals, and they may see someone who's covered in tattoos. I remember this one specifically, a patient of mine, and yeah, he came in, he tested positive for some drugs, but nonetheless, that's not the reason why he was sick. And the doctor comes out and it's like, oh yeah, he's, you know, he's taking drugs, and, you know, he's covered in tattoos, probably a gang member. I looked at her and I said, I got about 8 tattoos. Does that mean I'm a gang member? I'm just putting that out there. And he wasn't very open to her about telling him about his history and stuff like that. And I went back in there and I talked to him and kept it real. And I said, this is what's going on. This is what they need to do. And this is why. And he literally looked at me and said, she didn't say any of that. She was asking me what I was taking and why I was taking it. So you see what I'm saying? It's like, that is instilled not into the healthcare system. And, you know, because she was likely trained by that. She saw that behavior somewhere else, just like children. When we're going through nursing school, medical school, any type of education, really, whoever's teaching you, you kind of are like, they're little duckling. So even their good manners, but also their bad manners, you absorb. And so we have to make sure that we are practicing culturally sensitive care. And that's one thing I did try to pride myself on, is trying to be culturally sensitive to different cultures, knowing what they may, you know, respond to and may not to, but that it was a personal choice of mine. So yeah, I get cultural sensitivity training. It's probably maybe a 30-minute training once a year. But I took a personal extra step to sit there and learn a little bit more about different cultures. And that is not something that's being done in healthcare, you know, number one. And then as addressing like Medicare, making sure we all have access, that also means quality access. You can slap a clinic on the corner of Slauson and Crenshaw and, you know, give them all secondhand stuff, secondhand equipment, secondhand stuff, but you take that clinic and take it a few miles down and put it in Playa Vista, all of a sudden that clinic becomes a hotel. You know, it becomes an Apple store. You come in and you're signing in digitally. It's bright, it's airy, it's, you know, the colors are all promoting healing. But why can't that clinic have that same look and feel and access on Slauson and Crenshaw? Because those are people too, and they heal too, and they would appreciate that too. But is it because, oh, well, the clientele that you're catering to a different clientele? But in healthcare, why are we catering to clientele? Why are we, you know, we're no longer even calling patients. We're calling them, oh, well, this client. The hell? No, you're my patient. I'm just being honest. So that's what healthcare has become so corporate. So Medicare for all, if we're not careful, will be co-opted, just like Medicare was. Medicare Part C, Medicare Advantage, was the HMO way of health plans getting their hands on government money. And if we pass Medicare for all, we have to make sure that they don't do that, because then here we are again.
Well, just as a follow-up to your point, how do we get, someone raised this question, but how do we get more Black doctors and nurses?
I mean, to me, they're there. That's the problem, they're there. So 2 parts to this. When you grow up through the struggle and you go through college and you kind of break free and, you know, you do all these things, I was a first gen grad and, you know, all that stuff. I mean, I won't lie. I wanted to run away. I wanted to live a better life, you know, a life that I didn't see struggle and all that stuff that I went through. I wanted to actually enjoy my hard work. But one thing that we have to do on that end is that we have to open the door. We have to raise our hand back and say, you know, and become the example in our communities. That's one thing we have to do. And I think that mind frame, that mindset is happening more so than it was before, because I see people like my friends that have gone and become doctors and other ones that have become nurse practitioners. I see them turning back into the Black community more than running off to the nice hospital. Because when I first moved here, I'm from Indiana, y'all. When I first moved here, my first job was over at UCLA. I was like, hey, you know, I'm fancy over here in Westwood. But at the same time, I realized that the nurses and doctors at UCLA sometimes can scare the hell out of me too, just like any other place. But also, you know, I realized that, okay, well, I'm providing this top tier service in healthcare. But I could also be providing it at a clinic too, or in a smaller, in a local setting where more people look like me, you know? And then on the other hand, is that we have to promote and stop being, I don't want to say stop being picky, but you know, a lot of Black health professionals, we got cut out of the major university systems, you know? Like I was trying to get in, I couldn't, so I ended up going to some small college that doesn't even exist anymore, like ITT Tech, to get my first associates in nursing, because I couldn't get into major university. And I think that that's a problem too. We're being cut out of mainstream medical education. So we're going around and creating detours. And then we come with our degree. Now, granted, yeah, at that time I had an associate's, but I passed my nursing boards that were a board. That board was the same across the state, you know? So I had the same nursing license as anybody else, but because of where I went to school, I couldn't get a job where I wanted, you know? So that is another issue that's also part of the healthcare racism. You know, a lot of people of color are going to these 2-year trade schools and things like that to get their initial degrees because the 4-year universities are backed up, or it's really hard to get into, or their prereqs are taught in such a bad way you can't grasp it, so you keep failing the class. You know what I mean? So this is going deep. Like, you really want to peel back the layers of this onion. We're going to go deep. And to get more Black people and Black health professionals into the industry, we have to look at not just, you know, I'm not saying it's just affirmative action or anything, but we actually have to look at how we're being taught. And, you know, and even teachers that look like us, you know, because there's also we know there's educational racism. And so, you know, there's just so many, it's so many things tied together on why we don't have as many Black health professionals. But in the South, they rising up, because I mean, like, I'm seeing lots of Black doctors and Black nurses, and I'm so proud. You know, they're rising up on the West Coast too, everywhere. I think we're low key quietly taking over the healthcare industry. So I'm expecting to see that change really soon.
There's one other factor that we have to consider. One is creating Black associations and caucuses and the rest to help make the demand for culturally relevant teaching and application. The other thing, though, is we have got to deal with college debt. Because, you know, even if you can get into them schools, you're going to wind up coming out in such deep debt that your choices are limited. And so you may, you know, do some moonlighting in the community or something, but you got to pay, you got to, you know, you trying to make it and you trying to pay off this debt. So we got to deal with that also. So I think, one, we have to make sure that there are culturally relevant education and groups within the education system that demand it, fight for it, and make it real. Secondly, we're going to have to deal with the question of college debt, particularly for healthcare professionals, because I understand it can be tremendously high. I'm the father of a nurse and the son of a nurse. And my granddaughter is in the healthcare field. And, you know, in order to advance, you got to keep getting degrees. That means you're getting into debt.
Working on another one right now.
So we gotta deal with that also. The way we choose to finance healthcare, particularly, has got to be disconnected from debt.
Absolutely. And I mean, you just brought up a thing. I was pre-med. I didn't go to medical school because I did not want the 6-figure debt. I'm in 5-figure debt with nursing school, but medical school, that's straight up 6-figure, no way around it, unless you were blessed to be getting a scholarship of some sort, but that's 6-figure debt. Or, well, I don't think anybody on this call is that rich, but but yeah, or rich, you know. So that literally curbed me from being a doctor, was debt, literally.
And how tragic is that? I mean, here we could have had a doctor who was in the community doing some stuff, but you make a choice. Damn, do I want that debt or do I want this? And so at some point, we are going to have to deal with that in realistic terms, because we can't have good people making bad or short-sighted decisions, or not making the decision that's in their heart to make because of debt. So if there's a question in there about that, I hope we've addressed it some.
We have one more question that we'll wrap up with, and that was someone asked, what connections do hospitals and prisons and the police have?
Well, the prisons and the police are the reverse side of each other. The prisons are the containers. The police are the capturers. And in the middle of that is the justice system, or as we've learned, the injustice system. Part of it is hospitals, prisons, and police are all systems and have systematic approaches. And if the thread is racism, then they will all reflect that. So our police are racist, the policing institution, departments are racist, the prisons are racist, and you can see it, that same thread in many of the hospitals. And we all, and I certainly have personal stories about the hospitals and how they treat Black patients. A lot of it dealing with not believing that you're really in pain, or not believing you can really pay even though you got good insurance, or is this, and Jeanna, you can probably, I don't know how many times I've heard this question, is that your insurance? What insurance company is it again? And then they got to check and recheck because they want to make sure. You can't have this. I'm a Kaiser member, and I had to have, prostate surgery. And I had to go through, I had to prove to them that, and it was the top of the line Kaiser, and I was glad that I had it, but they questioned it. They really questioned it. Because at the time, I think I got it through my wife, and the work I was doing, it was like, how you get this? So the hospitals do reflect the same cultural racism that's in the broader culture.
Yeah, I mean, absolutely. That is very true. Or they don't, for me, even both sides, as a nurse, as a registered nurse, being a Black RN is not something that is too accepted in culture. It's celebrated in the Black community. When you get your nurse, when you're an RN, that is like, it's celebrated. But when you're an RN on the floor, I've been called the cleaning lady, big old red RN though, big old red RN right here on my badge, but I'm the cleaning lady, I'm the CNA, like I'm everybody but the RN, and God forbid that's the day I was actually a charge nurse and you had a complaint. Can I speak to your manager? Well, you're speaking to her. Oh, yes, oh. So on that end, you have to deal with that coming from the patients. And okay, that's fine, especially, you're dealing with patients of a certain age. And I get it. Whatever. But also on the other end is the, as a patient, and, when I'm a patient, I try not to tell people, oh, I don't go in there with my chest all puffed up, I'm a nurse. But when, their doctor's explaining something to me and, I'll kind of try to put him at ease and say, oh, don't worry, I'm a nurse, I get it. And he's like, oh, you're an LVN? No, I'm an RN. And he's like, oh. And it's just like, what? I can't be an RN, you know what I mean? Like, and so I experienced that as a patient too. It's like, I can't be a nurse, and then they kind of look at you and like, okay, well, we got to make sure she's a nurse. And it's really weird. Why is it that I can't be a nurse? Now, what if I would have went to med school? Then you would have been like talking to Dr. Jeanna. And I'm not going to med school. Don't even think about it. I saw Dr. Bill in here somewhere. I'm not doing it. But, then it becomes that too. And it's like, well, hell, like you go and you achieve, and then you still get treated like shit, or at least looked at differently. Now, when it comes to how it's connected, the prison system, the police, and the hospital, sometimes, and I've seen this firsthand, sometimes the hospital can be a mediator between both. When a patient, going back to that patient that was having maybe an autistic, meltdown and came into the hospital to be cleared, not often are you going to see the staff of the hospital actually look at the patient and take the side of the patient and say, something else is wrong here. I've seen it. I have seen it happen. But, not often. They're going to think that the officer's going to come and tell them this guy's on drugs. And this is drugs. They're on drugs. They're a drug addict, you know. And so the hospital can mediate this further racism and this oppression and these problems by just kind of like thinking that going off of whatever the officer told them when they brought them in. On the other side, when patients are brought in from the prisons, you know, they're too sick to be taken care of in the infirmary. They get brought to some local hospital, usually it's a county or something hospital. And, they might be really sick, but they're also treated differently. They are handcuffed to the bed because they are prisoners. They have a guard outside the door. But it's also the way that the doctors and we treat these patients, because we know that they're bad. They're bad. They're a prisoner. They're bad. Now, I will say, yes, there was one patient, he was an Aryan, and he had nerve to talk some shit to me. And so I will say I'm not perfect, but, I wasn't going to sit there and be talked to like anything either. You're going to put some respect on my name. But at the same time, like I said, I hated to hear the nurses and the doctors say, oh, I got to go look at that prisoner. And I'm like, well, that prisoner's Mr. Jones, and while, yeah, he did something and I don't know what he did, but I was like, he's still Mr. Jones, man, like treat him nicely, treat him like, cause it might be some of the best treatment he's gotten. And that goes back to that mental health of knowing that, healing in the hospital, that few days he was in the hospital might have put him on a different mental track. And so, like I said, the hospital can be the mediator between the streets, the police, and the prison.
Well, thank you both. We really appreciate having you, Jeanna Harris and Baba Akili. I want to just extremely thank you for your time, your candor, your passion, your life experiences, and sharing all of the strategies with us on and how we can truly fight. And I want to thank all of the participants who joined us today. We hope that you learned a bit more about how policing and prisons ties into the health of Black people and ways that we can fight, as Jeanna mentioned, and then also ways that we can challenge, confront, and if necessary, disrupt.
That's right.
That's right. There were so many comments in the chat in support of both of you, and so everyone here, I just want to express their value for the messages that you share with us. We want to also thank all of the organizations who helped make today possible. And we invite everyone to join us for our next discussion, which will actually be on the social determinants of health on September 14th. And if you'd like to learn more about that, you can check the Facebook page for Dsa Medicare for All Committee. So, and we also invite you to connect with us all on social media platforms. And if you have any other questions, please feel free to reach out. So thank you again, Jeanna and Baba Akili.
Thank you. And always Baba Akili. It's been fun. This is becoming a norm for us. I look forward to more.
I also want to thank all the people who put this together and all the pre-work that went into this and all of the volunteers and staff of people that actually made this happen. This just didn't come together. That took some planning and involvement and investment of time. So I really want to shout out to them, and I really appreciate that, and I'm glad I could participate.
Yes, and I'm also looking forward to working more, closely with the Afrosocialist Caucus. I am a DSA. I didn't say I'm a DSA member, but I'm looking forward to working it because I think that you guys are also going to help us be a conduit into the single-payer healthcare conversation into the Black community, as it also is part of a socialist agenda. So I'm looking forward to all of it, and thank you guys all who've been watching this from across the country and even in Alaska. I really love Alaska. I love the person in Alaska that has tuned in to watch this. That just really touched my heart. So thank you all, and continue to fight the fight. But most importantly, since we talked about mental health, take a break, go take a walk, get some fresh air. This fight is a marathon. Actually, it's Ironman, and we can't do it if you guys are burning out. So take some time for yourself.
Thank you.
Thank you guys.
Bye, everybody.